Welcome to this short patient information video where we hope to give you a basic introduction to glaucoma. It's important to remember that everyone's journey is unique, so if you have any questions or need further advice, please feel free to ask us when you come to the hospital.
Glaucoma is a common eye problem and is the name for a group of conditions in which the optic nerve becomes damaged. Now, the optic nerve is at the back of your eye and it's important for sight because it's the pathway for the signals from your eye to your brain. Glaucoma is thought to be due to the pressure of fluid inside your eye being too high for your eye to tolerate. If it's not diagnosed and treated early, it can lead to progressive loss of vision. Glaucoma is common in the UK and it affects around 2% of the population over the age of 40.
Glaucoma can be challenging to diagnose, and you may have been referred to us by your optometrist. We use a combination of repeated tests and measurements to look at progressive changes. These include examinations and measurements of your eyes, visual field tests, and scans at the back of your eye.
There are many different types of glaucoma which can make diagnosis complicated. Broadly speaking, they come under two categories: open-angle glaucoma and closed-angle glaucoma.
The majority of people have primary open-angle glaucoma. These patients may not experience any problems in the early stage, and for this reason, many people don't realise they have glaucoma. It's often picked up by their optometrist during their routine sight test.
As glaucoma progresses, blind patches begin to form in the outer edges of your peripheral or side vision. These first few patches in your visual field are subtle and your brain fills in the gaps. However, if it's allowed to progress, slowly over time these extend further to cause tunnel vision, and in very advanced glaucoma, central vision may be affected too. Very occasionally, a type of glaucoma called acute closed-angle glaucoma can develop very suddenly. It's a less common form of glaucoma and it's a medical emergency which needs urgent treatment. It leads to a very high pressure within the eye and patients can experience blurred vision and an intensely red, painful eye.
Although vision which has been lost to glaucoma cannot be recovered, with early diagnosis, careful monitoring, and regular use of the treatments, further damage to vision can be prevented and most patients retain useful sight for life. The three main treatments available are eye drops, laser treatment, and glaucoma eye surgery.
There are many different types of eye drops and combination of eye drop therapies that are used to help reduce the pressure inside your eye. An alternative to eye drops is a certain type of laser treatment called laser trabeculoplasty. It is a short procedure that takes place in the laser clinic and it is usually completely painless.
Eye drops and laser treatment tend to be the first line treatments for glaucoma. Glaucoma surgery is reserved for advanced glaucoma or uncontrolled eye pressures. The aim of glaucoma surgery is to improve the drainage of fluid in the eye to reduce the pressure. There are many pros and cons to surgery which your ophthalmologist will discuss with you in depth if appropriate.
Many people with glaucoma are able to carry on driving depending on how much of their peripheral vision has been affected. You are required by law to report to the DVLA if you have glaucoma in both eyes. The DVLA will independently assess your visual fields on a regular basis, ensuring that you are safe to drive.
Many thanks for watching this patient information video. We would be very grateful if you can fill in the survey and send it back in the prepaid envelopes.